Hi, welcome back, Dr.
Thanks.
Ian Lusbader.
Always a pleasure.
Having you here to talk about a really interesting topic that I think a lot of people are concerned about. The topic being, how do we know when mom and dad are going through a decline? How can we recognize that this is something that we should start worrying and preparing for?
Certainly, in the office we see patients who come in at various ages, usually, certainly after 60 or 65, where people worry about memory issues or forgetfulness or forgetting where their keys are or being in a room with other people and they're like, I know that name, but I cannot recall it. And that happens to a lot of people, and part of that can be part of normal aging. And if you don't see the people frequently, you may not remember their names. But patients sometimes bring that up, and sometimes family members who accompany them are also worried.
They're noticing that
they're noticing some changes, and sometimes the individual, usually a parent or elderly relative, may be in a bit of denial. I'm fine. There's you're imagining that, and the family sees changes that are going on and are concerned, and it's often a difficult dance and relationship to explore that and to get help and ask for help sometimes, because people are often very proud. They want to remain independent. So there's really a variety of ways that people present. Either they're too worried in many cases, or they don't really acknowledge that they are declining.
They may not even know. I mean,
when
you look at them, they might look different, or how, if a child comes home, and how do they really know they're seeing mom? And mom seems to be mismatched, I guess, and wearing things.
So certainly it's great. First of all, many people age alone, and they do not have family or friends come by. So it's one step that's positive is having either a child or an interested family member that raises an alarm. And some of the changes can be changes in hygiene. They take care of themselves less. They're more rumpled. They forget to do the laundry. They may be losing weight. They may not be shopping, buying enough food. They may not be eating. Bills are becoming unpaid. Sometimes service is turned off, phone service and so forth.
Oh, that's right. The phone won't be working, and
the phone may not be working.
And
it's harder
they're
to
confused
contact
probably
them.
with.
They may be forgetting to take their medication or think they have taken their medications. We try to lay them out with pill boxes and do a variety of things to help. They may be confused.
How does a child know if they're taking the meds correctly? I mean, how?
Sometimes they count the medication or often lay it out for the parent weekly if you're lucky enough to have an interested offspring who will come in and interact with the doctor.
And the parent has to let you.
And the parent has to let you get a social worker. And often we do lay out the pills, in other words, and it's labeled AM, PM, Monday, Tuesday, Wednesday, Thursday. So hopefully at a basic level of functioning, medication can be laid out.
And if they take too much, what are the signs that say?
Patients often forget, I can't remember if I took my blood pressure pill. So they may overdose, and their blood pressure may be too low. So it really varies what medications they're on. If they take too high a dose of a cholesterol medicine, nothing may happen. But certainly if they take too much of a heart medicine, the heart rate slows too much. So there are a lot of issues. There may be unexplained falling. Certainly you can have psychiatric issues too. Dementia, psychiatric issues. People spend too much, or they max out their credit card. Or sometimes they just have social withdrawal. They're less interactive with friends. All my friends have died, and I feel very lonely, and they're unable to make new friends or younger friends, even if encouraged to go to book club or social groups or things like that. They become often more withdrawn. Sometimes, odd behavior, they can be inappropriate. Some forms of dementia can present with inappropriate speech or inappropriate sexual behavior. And the
so
patient
all of a sudden
may
they
not
get
know.
like 10 girlfriends, dad gets 10 girlfriends, and
potentially. So that's, and of course people may be in denial about that. And certainly one of the things that we do is if patients, as they get older, their reaction time slows, taking away the car keys or telling patients are really not able to drive can be a big point of contention.
And what's the difference? I mean, a lot of people are asking, okay, what's dementia and what's Alzheimer's? I mean, how do they know if should they worry about Alzheimer's? Should they worry, like, what's the
Well,
difference?
that's a whole big discussion.
That's a
Maybe
big
we'll do
one, yeah.
another talk about dementia, cognitive changes, and there really is a spectrum of behavior. Mild cognitive change, where you really go to a neurologist, you do what's called neuropsych testing, and they test memory and judgment and a whole host of things. Sometimes in the office, we'll do 3 objects in 5 minutes. So we'll tell someone, here are these 3 objects, say it back. You continue discussing other things, and then in 5 minutes you say, what were those 3 objects? So, there are a variety of very basic and more advanced ways to assess that. And then sometimes we do, tests, brain imaging and so forth. But
and does it happen quickly? Or
well,
does
it varies. It can be a very slow process. There are some forms of dementia that are rather rapid. Again, you have to see if...
So it's not overnight. It's not like something...
Usually not. If it does happen overnight, then I'd be much more worried, like about a medication overdose or a skipping medication or a psychiatric issue or some other trauma. If someone suddenly deteriorates, they could even be sick.
So that's important if it's sudden or if it's like slow.
A urinary tract infection, a pneumonia, bronchitis, even a viral infection in people who are frail can really change their mental status. And that would be appropriate to perhaps bring them to the emergency room, do a blood test, do a urine test.
Anything fast, you take them to the emergency room and you take care of it that way.
You have to rule out other causes of mental status changes. If someone is already plugged in and they have a slow decline, it's important to see a neurologist, but also to plan ahead. Do we have advanced care planning? Should they be resuscitated? What do family members think about this? What are the patient's wishes? Do they need to move to assisted living? Do they need to go to a nursing home? Can we provide home services? So there are a lot of discussions that have to go on. And the children or the offspring or friends also shouldn't be in denial. They have to approach this. Sometimes
they
people
become
become defensive or feel uncomfortable and say, Mom's not so bad, because it really is a bigger responsibility for the family members or friends when they acknowledge the parent or relative, needs help.
It's so interesting, and it's a long topic, and I know you'll come back to help us decipher
It's just some things to think about and to seek help and to ask for help from a neurologist. Often it takes months to get into these specialists, so you
want to make the appointment early.
Do it early and plan ahead.
Thank you, Dr. Ian.
You're welcome.
We really appreciate it. We'll see you next time.
Next time.